It's all about data integration and finding synergism and complementarity. And in fact, I think the most interesting evidence we are seeing in emerging data from the newer clinical trials with modern, highly effective therapy, as well as next-generation tools to characterize the patient, is the fact that in myeloma, risk is dynamic. What I mean is that a patient can be or can have high-risk disease at diagnosis, but if the patient achieves a deep response to treatment, and I'm alluding to a negative MRD result with a limit of detection of 10 to the minus 6, this patient gets upstaged to a standard risk myeloma because progression-free survival is identical to those patients with standard risk myeloma also achieving a negative MRD result. By contrast, if a patient starts with not high risk, standard risk disease, if there is persistent disease, this almost implies that the patient has turned into a high risk feature. Therefore, the concept that risk is dynamic and that we can appreciate challenges or changes in patients' risk if we combine initial upfront risk stratification together with sensitive assessment of response to treatment. Well, it's outstanding because in only a few years we have seen a great improvement and advance in the way we monitor MRD, both from a cellular point of view. We had low sensitive flow cytometry in the past. Together, equally important, many different protocols being done in many different laboratories, therefore lack of standardization. On the other hand, we have ASO-PCR as a molecular approach, and perhaps this was more standardized, but was also time and labor consuming and was not applicable to a significant fraction of patients. And nowadays we have next generation flow that is fully validated, optimized and standardized by the Euroflow consortium, is being used in many different hospitals around the world and has the same sensitivity as the molecular methods. And on the molecular methods we have now next generation sequencing that perhaps is slightly more sensitive than ASO-PCR, but most importantly applicable to more than 90% of myeloma patients. And on the other hand, we have PET-CT that is becoming more and more used, that is providing very important results, and even on PET-CT we are seeing some innovation regarding, for example, the tracer that is being used to detect uptake in those myeloma cells.